Hey, good afternoon, everybody. This is Eric with American Business Systems. I hope that you're doing well this afternoon. I appreciate you, everybody, joining in with me this afternoon. Today, we're going to be talking about how to build your network and connect with leaders in healthcare. Folks, this is a really great webinar to kind of go through a step-by-step guide for what we would consider to be our ABS medical billing business owners. So you're in for a treat this afternoon. For those that have been able to take some time to join us this afternoon. It's good to see Stephen there, so thank you for joining in. I got some others that are just about ready to join in. I can see here. And so, folks, if you'll just give it a few minutes here, we're going to wait for a few folks to join in. I know that I kind of had to start this thing a little bit later than normal because there was an update for the Zoom webinars, and it's kind of thrown me off my groove a little bit. So everybody just be patient with me as I kind of get through this. But again, welcome everybody. It's good to see you. I hope that you had a great week. I hope that you had a great week since we met you last week. If you remember last week, we had an incredible interview with I think his name was Roberto and his partner there. And so, yeah, that was an awesome webinar. So they're doing really, really well. There's a lot of best practices that you can take away from what they're doing and currently doing. So it was a great webinar. I was grateful to have Adam on there with me this that Wednesday afternoon, and it was just good to kind of get to hear from some of our folks that have been in the ABS business as business owners. But today we're going to be really kind of talking about kind of pulling back the curtain a little bit. Because so many people, once they get started here, you're engaged with your sales rep here. Folks, we understand that the biggest question that most people have at this point is really, how do I get clients? And this is what this is all about. How are you going to build your network? And there are some things that you can actually do prior to getting started without really hurting anything, and just kind of seeing what you can start doing as you're leading up to getting your business going as a medical billing business owner. So again, let me kind of introduce myself here in just a moment, but I'm waiting for a few more folks to come on in. Here they come. I got Muhammad here. Whale, good to see you. Funmi, good to see you. I appreciate everybody joining me this afternoon. And I see that, again, that there's some more people just trying to, I don't know if the Zoom meeting's lagging a little bit today, but I know that it did for me just whenever I was trying to log on here. But anyway, all right. So again, folks, let's kind of get this kicked off here. We're going to be talking about how to build your network and connect with leaders in healthcare. This is basically a step-by-step guide that I'm going to share with you. Now, I'm not sharing with you everything that we're going to teach you because that takes, 4 to 5 days of just everything that you're going to do to get your first client. But we're just scratching the surface here today, and I just wanted to kind of share some of this information with you. First of all, I want you to know where the Q&A box is. So if you don't mind just letting me know where you're calling in from this afternoon, just type in your city and state. That'll be helpful because there's going to be some opportunities for you to ask me some questions here this afternoon. So I want to make sure that you know where to go get that information and put that information in there. So if I can get a few folks, maybe Stephen, you could pop in there and just tell me where you're from, and maybe anybody else here that's on the call. If you have never met me, my name is Eric Auger. I'm the Director of Learning and Engagement. I've been with ABS a little over 18 years. Kind of give you a little bit of my story here. I first started off working with Patrick and Adam and this crew here. Did everything from, doing everything, just anything and everything that needed to be done here at American Business Systems. But for the last 10 years, and whenever I was doing this a lot with Patrick, we were doing a lot of these webinars together, and I really kind of love this opportunity to be engaged with you, kind of sharing with you some of the high topics of some things that you're should be wanting to learn prior to becoming an ABS business owner. And today, that's what we're going to be doing. We're just going to be dealing and kind of digging in. I want you to see that it's not going to be as difficult of getting referrals and getting doctors to have the discussion with you about their medical billing. So that's my role today. Hopefully, you're going to learn from me. Hopefully, we'll have some engagement together. Yes, have I owned medical billing companies? Yes, I've owned two of them. To let you know about that through American Business Systems. So both times I've gone through the whole thing that you would be going through of getting your first client. Everything from I enjoyed getting out and going and seeing doctors, but I did a lot of social entertainment type things where you're going to see that kind of today of some of the things that I think probably is some of the best techniques out there to kind of get into the world of this healthcare world. So I'm going to be talking with you from as a business owner to you. So hopefully it's a kind of a CEO brainstorming session here, this melting pot of all these brains here. And so if you got any questions, feel free to ask me at any time during the webinar. If you've never met Adam Phillips, Adam is our CEO of American Business Systems. Adam's written several books, one entitled 9 Ways Doctors Let Money Slip Through Their Fingers. He co-wrote that with Dr. Vicki Rackner, who I've interviewed several times on our webinars. You usually try to get her at least twice a year. Just interviewed her earlier this year, and we'll probably get her sometime the second half of the year to see if she'll join us again. She's a very busy woman. She's actually helping doctors try to figure out how they can keep more money into their pockets. She was a former general surgeon herself. She had her billing done in-house. She found that outsourcing it was the better way. And now she's actually teaching doctors and showing doctors that getting their billing outsourced is better. She is also on the board of directors of an organization called Myrma. You'll see that here in a little bit. But there's a great way to get a hold of this book if you'd like to. If you'll wait till the very end, I'll tell you how you can actually get maybe a copy of this before the day's end. But Adam is also a contributing writer for a business billing and coding magazine called Billing and Coding Advantage. He has written several articles. He's got a couple of them that are going to be coming out this year, but a couple of them that you might want to consider getting from your sales rep as a PDF. The Shrinking Private Practice, Why Billing Expertise Can Be a Lifeline for Doctors. You can get that one. And then one that we've discussed a lot last week, which was artificial intelligence. Will the advancements in AI take over my job as a medical biller or coder? Now, if you didn't get a chance to see the webinar that we did last week, the folks that were on there that we were interviewing just said that if you're not engaged with AI right now, you're already behind. So don't be left behind in AI here and learning it and how this actually will help you. Not only help you grow your business, because there's some really wonderful things that they're doing with AI now for social media. Really getting the word out about what you're doing, but then also on the billing side of it, there's a lot of great things. And as any doctor will tell me so far, Eric, I would never trust my entire billing to go through some robot. I want to have somebody that I can talk with and discuss with and have strategies on how I can improve my cash flow. I can't do that with a robot. So you're going to be able to do that. But anyway, there's an organization that Adam also started called Myrma. It's the Medical Revenue Management Association of America. There's a board of directors, which Dr. Vicki Rackner is the medical director for this organization. It is this organization that you'll be a part of once you become part of ABS. It's the nation's largest group of independent medical billers in the country. And it is this group that will certify you as a certified medical revenue manager. So you get the privilege of that. Being associated with Myrma, you will be able to carry their logo, their contact information on all of your marketing material and letting people know that you've been certified by them. All right, so enough with the introductions here. Once you see this slide throughout the presentation, I want you to shoot me a text over here. Give me some questions. Feel free to ask any question you'd like to. The other thing I would request from you is that if I did answer your question, because sometimes I never know if I've got the right answer for you, if you'll give me a thumbs up, I'll know that I've answered the question, or a little heart. If you just put a raise of hand there's a little icon that you can just raise your hand. You can say, hey, I want you to kind of go a little bit deeper. So, but a thumbs up and a heart means, hey, I've answered your questions there. So that'd be good. All right, folks, enough with the introductions here because we only have about an hour and we're almost already 10 minutes into the webinar. And I really want to start diving in here with you about how we teach brand new medical billing business owners here at American Business Systems, things that they're going to need to do when they're out there marketing their business and getting networked within the healthcare community. Now, I want you to kind of, first of all, I want you to, if any of you have a marketing background, take your marketing cap off for a while, okay? Because if you've ever done marketing for any other business outside of doing anything with healthcare, it is a different animal a little bit. So what you think you might be able to bring to the table with some strategies and everything may not always work, especially with healthcare in the healthcare industry. What we've learned here is that healthcare industry, how people get to do business with people in the healthcare is truly by referrals. And one of the things, the best thing that we're going to help you do here is learn how to strategically market your business and get engaged with other people that are in the healthcare industry. One of the things that we hear time and time again whenever we're dealing with folks that are with ABS and that have gone out there and marketed their business, they have said that their slowest start was when they didn't let people know that they were in business. Those that got out there and went to some of these networking meetings that I'm going to share with you, got engaged with some of the healthcare industry groups that I'm going to share with you today, kind of did some innovative things, they got their clients much faster. So why not teach you what we're going to teach you in training, not to the extent. So we're going to touch on some of these things here. But before we start marketing or building a marketing strategy, I want you to think of 5 things physicians really need, okay? So I'm going to kind of go through these pretty systematically, because if you'll grasp this part of it, the other part that I'm going to be talking with you about on why you're in the business will make so much more sense, okay? Because you're not just trying to come out with a new widget. What we're trying to do is help you understand and get into the doctor's issues that they're really dealing with here. So before I get started here, there's a couple of things that you might keep in mind. You can take notes while I'm going through the webinar. This is being recorded, so if you want to go back and listen to it a little bit later, you can. For those of you who are savvy enough, you know how to do screenshots. If you'd like to take some screenshots, feel free to do that through any time of the presentation. Or even better yet, if you'd like to get a PDF copy of today's webinar, just get back with your sales rep and they'll get you a PDF copy of this, okay? So physicians didn't go to school just to run a business. Folks, this is Dr. Vicki Rackner has said this so many times. She goes, Eric, I went to school to become the best general surgeon that I could. There wasn't one time in all of the training that she had where she learned about how to run the business. Now, you would think that doctors who have gone to school, that they would have some business school acumen, but they don't. They just don't get it. What they've gone to school for is to heal people, but your job is to help them give back to them, give that back to them. So, listen. Don't let these doctors keep drudging along their lives and worrying about their business. Think of it this way. If there is an industry for you to get involved in, for you to be an entrepreneur in medical billing, that ought to tell you a secret right there real quickly. That if a doctor's trying to run a medical practice from a clinical standpoint, that in and of itself is a business all by itself. But if they're also trying to layer on doing medical billing and having their business run that way in-house, that in and of itself is another business model. And those are 2 separate models there. That's why doctors, again, don't do their own accounting. If you think about it, this is really on the other side. Doctors don't do their own financial advisors. So why would a doctor do their own medical billing? And so If we can help educate these doctors to get that out of their office, the better things will go. Okay, so let's talk about the number one need that doctors have, in just dealing with these things. And then we'll go through all five of these all at one time in one other slide here. But the number one need, the doctors need to reduce their administrative burden. They are so stacked already with regulations, their own medical malpractice of everything that they have to keep up with there, uh, building leases, or building ownership, equipment ownership, payroll themselves. A lot of times doctors don't even do their own payroll. What do? They outsource their payroll. They are smart enough to at least outsource their payroll, but some of them try to do their own payroll. I don't understand it, but it's a business model that they just need to get rid of. Just same thing as with medical billing. They need to outsource their medical billing. The doctor staff, your staff, as a medical billing company should be, or the doctor staff should be caring for their patients and not filing claims. They don't need to be doing that. And if a doctor tries to do their own medical billing inside, what happens is that they'll end up hiring somebody at $45, $50, $60,000 to do their medical billing. And then once they get them in their clinic, they get assigned to other things. I'm sure you've worked for someone, and they assign other things as necessary. So and that's what happens, and that person gets distracted, and then the doctor goes, "Well, I hired you to do a role here, and why am I not getting paid? I want to know what's going on. Why am I not getting my Medicare payments? Why am I not getting payments from United Healthcare, or Aetna, or Cigna? What's happening here?" Well, it's hard for that person to go, "Well, you've got me scheduling patients over here, and now you want me to do billing on top of that." And it just gets into a rat race. And I'm going to show you here in a little while through a chart just the financials alone of what it costs to have a doctor in-house versus it having outsourced. Okay, so we'll go through that. So again, the number one thing doctors need to make sure is that we can help them reduce their administrative burden, let their staff do what they do best, and that is to take care of patients. And again, this is one of those other things that everybody's gone to the doctor at least once in their lives. I mean, everybody that's on here has gone to a doctor, and you get frustrated as a patient if your appointment is at 11 and you got there in plenty enough time, but then the doctor doesn't end up seeing you by 11:30 or 11:45. That's an administrative burden. Something's wrong behind the glass already. If that's happening, the office in and of itself is running very inefficiently. And again, if that's happened there, it's happening with their billing. Okay. Number two need, the doctors need to increase their cash flow. The average practice loses about anywhere from 10 to 30% of their collectible revenue every single year. Now, you can go Google that. You can go AI that through ChatGPT or anybody else out there and find out that these numbers are pretty accurate. We know that's accurate because these are what we find whenever we're doing a practice analysis with a doctor. We find out that their balance sheets are way out of whack. And one of the great things, if you'll go back and listen to the webinar from last week, one of the things that this group was doing, this new ABS group that Roberto and his partner there were doing, is that they're actually engaging doctors early, getting their data and utilizing AI and showing all these charts and graphs now of showing the doctors where they're losing money in a picture form, not just these chart bars and graphs like that, but really just showing them really what's happening. And if they were to switch over to them, the possibilities of the money that basically they're just leaving on the table. So let's help these doctors quit losing 10 to 30% of their collectibles every year. Now, the reasons why for some of those are certainly because of the claims that are denied are never resubmitted. Just think about that. The poor biller there that works at a doctor's office is trying just to keep up, and they can't keep up. They can't keep up. They just can't keep up. All right, number three, we need to help them reduce their exposure. Coding errors, compliance gaps, and audit risk are silent threats to every single practice. We actually have, not only do you have the access through iClaim and EMRX and the internal AI that's already working in those platforms, we have some other AI assets that can help you along the way as you'll go through here. But we have a service called Compliancy Guard that will actually help close some of these compliancy gaps that doctors are faced with. Audit risk are always happening. Whenever they get a letter from Medicare and they want to go through a Medicare audit, then that means that doctor has to fork over so many charts for Medicare to review. And usually what happens is that the doctors pretty much know that there's going to be a clawback of some sort, meaning that Medicare is going to find some ways that they overpaid the doctor and they're going to ask for that money back. That's what clawbacks are. So whether it is coding errors, whether it's compliancy, HIPAA compliancy, whether it's just the audits, we have Audit Guard here as an asset for you to help these doctors reduce their exposure to either the loss of their money or compliancy issues. We have all those services that are at your fingertips, okay? Number 4, transparency reporting. Physicians deserve to know exactly where their revenue stands at all times. Now, here's a winner again. I'm going to refer you back to the webinar that Adam and I did with a couple of our business owners last week. And again, what they're doing, they've been able to share with the doctor, hey, here's some things that we can do prior to you thinking that you want to switch over to us. But what we're going to need is to sign in some type of agreement, and they're getting them to sign an agreement to say, let us at least look at a forensic way of looking at your data, okay? And again, it's through that data collection and some of the things that are done through there that they can run through some of the new AI assets that are out there and create a reporting system that shows the doctors basically where they're losing, where money's being left on the table, and where money's are just simply not being collected. Now, obviously, once they're a part of our system, if they have chosen to go with the iClaim platform, then our reporting is very transparent. It's actually at their fingertips, and we can show the doctors even how to run some very quick reports and just actually be able to log in from their iPhones, iPads, their Android tablets, from wherever they are, as long as they got to log in to any type of internet system, they can actually log into our system and see exactly what's going on. They'll see how many claims that you process in a day. They'll see how many claims are being processed at the clearinghouse level. They're going to see how many claims are actually going through adjudication. They're going to see how many claims have actually gotten paid. And mainly, that's what the doctor wants to know. How if I pushed out 100 claims to you, how many of those claims are getting paid back? And as long as they're seeing close to 80 to 90 to 100%, 98% of those being processed and then paid, the doctors are extremely happy. All right, number 5, and the last thing here that we'll go through here, and that is a focus on patient care and not on paperwork. Remember, doctors went to school to take care of patients. They are clinicians. They are not financiers, And now some of them might think they might be, but really at the end of the day, they are clinicians and they went to school to help people. And this is why they became doctors. Your business is to make it possible. Now, let me explain something to you. I've actually seen this happen whenever a doctor has struggled, and then the community of the patients there, they're frustrated with that doctor because, again, late appointments and everything else that goes along with that. But whenever someone was able to get in there and help that doctor turn their business around, the doctor's not so much worried anymore about their finances. It actually improved the entire healthcare of the community. The patients weren't frustrated as much. They're getting their patients to see a little bit closer on time than what they've been. So it helps an entire performance improvement whenever you can help these doctors can focus on their biggest thing, and that's their patient care. That's what they want to do. they also want to know that they're getting paid. That's at the end of the day, that's what they want. So we know this here at American Business Systems. We know that when you understand what physicians need, which were those 5 things that we talked about, everything starts to change. So everything else from here on out for the rest of this webinar hopefully will make a lot clearer sense, because again, you're going to help them reduce their administrative burdens. You're going to get that bulk of that administrative burden out of their office, and you do it from home. You're going to help them increase their cash flow. You're going to help them reduce their exposure. Fourthly, you're going to help them to have transparent reporting. And then lastly, they're going to be able to be focused on their patient care. So folks, if you understand what's going to happen here, this is an incredible opportunity for you to help these doctors in these 5 areas. So if you've done nothing else so far, again, if you want to take a snapshot or a screenshot of this one slide kind of sums up everything that I've gone through over the last 15, 20 minutes here. Okay. Are there any questions so far before we go on any further? Because now we're going to switch gears here, because now we know what the need is. No, it's much better to know where the pain points are. Some of the things I'm going to be talking about, some of these folks that I'm going to be involved in healthcare, how am I going to have this discussion with them? And so whenever I'm looking at these strategies for acquiring my first client, now I think these are going to make a little bit more sense. Okay. Any particular questions so far? You know what? If I could just get somebody to say yes, at least your voice is coming through. I want to make sure my voice is coming through, because I haven't had anybody put in where they're located. I haven't seen anybody say that they're hearing me. Can somebody, Latanya, now you've been on a webinar before with a webinar before. Do you mind just popping in a question over there in the Q&A box? I want to make sure this thing's working right. I'll wait for someone to pop in. Okay, good. Thank you. Kanya, I hope I said your name correctly. Kanya Boo Timbo. Okay, so hello. Okay, so at least somebody's hearing me. Thank you so much. I appreciate somebody chiming in there for me. Just call me Connie. Okay, got it. Thank you. I appreciate that. All right, so very good. So at least I know I'm being heard by Connie. So if there's any questions from anybody else, feel free to ask me these questions. So now, as we kind of go through this is where we're going to start digging into about four different strategies here. We went through 5 things that are deep needs of a doctor. Now we're going to go through 4 strategies here, and I'm going to kind of walk you through this. Now, this is not verbatim of everything that you're going to learn in our training. You're going to go much deeper in our training. Again, I'm scratching the surface and I'm giving you basic ideas of what can be done and what you need to be doing to do this. Latanya is asking, is medical coding the same thing as the billing part? Yes and no. Here's, I think, what you're trying to ask here, and help me out if I'm correct for you. Are you going to have to know medical coding to do medical billing? You do not have to know medical coding, because it is the doctor's responsibility to get you the codes to actually put into a billing platform. That's exactly what they do with their biller in-house. So now, will you learn coding as you go through this? Absolutely. You're going to find out that eventually a 99214 is about a 20-minute visit, normal visit for a doctor to see an established patient. That's what you're going to learn. Over a period of time, you're just going to kind of learn, because if you're dealing with a specialist like a podiatrist or a psychiatrist or just a general practitioner of some sort, their codes don't change that much, because they're seeing basically the same thing over and over and over again. So you'll get to learn that. So Latanya, let me know if that helped answer your question. But medical coding, you need the codes to do the medical billing. And before I go any further, it's just to kind of let you know, there are 2 different types of coding or codes that are going to be needed. There's what's called a procedure, a procedure code, and a diagnosis code. Now, the diagnosis code is what's wrong with the patient. they've got a cough, they've got an ingrown toenail, they've got a migraine. That is a diagnosis. You're going to take that diagnosis code, put that into a billing system, and then the procedure code of what the doctor did for that patient. They saw them for 15, 20 minutes. That's a particular code. If they gave them an injection, that's another code. If they did some type of another office procedure, that would be another code. That's all going to be on that one sheet there for that particular day of service. So, Latanya says she would like to know a little bit more about coding. So why don't you do this? Get back with your sales rep and ask them to show you the couple of the services that we have. We have two different code. We have CodeWrite service, and then there's Audit Guard. So write both of those down. CodeWrite, code CodeCodeRite, CodeWrite. Okay, and then Audit Guard, which is the other one, which are utilizing medical coders to help you build your business through that. Okay, very good. All right, so here's the first strategy. First of all, we want to help you build your presence. We want to make sure that you are equipped with everything that you're going to need to know. This is why we're going to put so much emphasis on your training. So like with Latanya, she's asking about coding. There are elements of coding that we go through in our training. Do you need to know every jot and tittle about coding? You don't need to know that. We're going to help you along the way. There are people who literally have never had any medical background come into this business. I didn't have any medical, I had no healthcare background whenever I started with American Business Systems. But you just learn it. It's a learned process as you kind of go through this. But we're going to help you, and we're going to give you all the tools that you're going to need so that you can start the engagement with people in healthcare. Now, you heard me right. So again, hear me again. I want you to be engaged with people that are in healthcare industry, not always necessarily a doctor. Okay? I think what happens is that a lot of people start off and they go, oh, I need to go find my first doctor. And yes, even though that's the end goal of what you want to be, what I want you to understand is the importance of being part of the healthcare network within your community. Because there's a lot of different people out there in the healthcare community. You got folks that are involved in Meals on Wheels. You've got people that are involved with home health. You've got people that are involved in home care, which is totally different than home health. Okay. You got home care. You got folks that are in physical therapy. You got folks that are in occupational therapy. You got people that are involved with those that are like nurse practitioners that go see patients in their home. There are licensed social workers out there. So I've given you 7 different types of providers that are not necessarily doctors. And the more that you get engaged with those people and the more those people know you, the broader your world becomes. And you'll hear me in a little bit of learning how to build your business orbit. This is what we're talking about right here. So you're going to see some of the organizations I want you to kind of think about getting engaged with. But before that, I want you to know that we're going to help position you as really a master in the healthcare industry, which is going to help your clients operate rather than just merely processing claims. Because we're looking at things holistically in that doctor's office there. So think about it. If we're talking holistically, we're not just a medical billing company. One of the things I want you to kind of get out of your vocabulary is that, hey, I've just opened up a new medical billing company. Okay. You're not in that. You're in what's called revenue cycle management. All doctors understand that. Everybody in the healthcare industry, your healthcare community, whether again they're home health or home services, hospice, in any of these organizations that you're going to come to get to know, and they're going to get to know you. Whenever you start to talk with them about what you do, you help doctors reduce their claims that they're not getting paid on. We're eliminating them from them not getting paid. We want to increase their revenues, reduce their rejected claims. This is all that we're about. This is what we do. We do this. We've been doing this for 30 plus years. You're just now part of the nation's largest group of independent medical billers that have been doing this for over 30 years. That's what you do. So this training, as Latanya was asking earlier, I want you to know this training goes beyond just medical billing codes, okay? It really does that. It's going to cover clinical workflows, everything that has to do with regulatory requirements, the financial aspects of every single doctor's office, because it starts with that. Because if you just go to the doctor and say, hey, look, I've got a better billing system than you have, that ain't going to work. What you need to show them is, doctor, I need to see your data. I'm going to forensically look at it. I'm going to show you where you are and where you need to be. Now, think about that. Is that any different than what a doctor does when you go see them? I mean, if you walk in, the doctor doesn't go, I bet you have ingrown toenails. No, you got it. The doctor says, tell me why you came in to see me today. Well, I've got this pain in my foot, or I've got this itch or rash on my arm, or I've got this whatever. I got the stomach ache, and the doctor's going to do an examination. So they're going to forensically look at you to go, yep, I can see what's wrong. This is what it's going to take to get you well. And that's what we do. If we go in and rush into a doctor's office or anywhere out there in the industry and we say, hey, I know I can solve every doctor's problem, then nobody's going to listen to you. But if you can say, what we do forensically, we really kind of dive into the doctor's data and we find money that they didn't even know that they had. Now you're talking a different language. You're talking on a level as of a CEO, letting another CEO what you can do to help them. Kanya's asking, what would their claim manager be doing? If they do have somebody that's in their office that is a claims manager of some sort, they can be a great asset. They're just not doing the billing in-house anymore. They're going to get that out. They're going to help funnel that through to you. One of my first clients had a billing manager there still on staff, and I worked directly with her even though I was doing the billing outsourcing, and it freed up her life just tremendously. Okay, so how are we going to do this? Well, we're going to go through a pretty in-depth certified medical revenue manager training course with you. We don't have time to go through this entire outline and agenda. It's huge, but just to let you know, there are 10 basic modules, and inside those modules are sub-modules through that. It's going to take you about 2.5 weeks to get through our training here, but your training doesn't end with doing our online training the way that we do this. And it's with a live instructor too. It's not videos that you're going to go through. And that instructor is going to give you homework at the end of every session. So this is why it's going to take you some time, because we're going to teach it to you. We want to make sure it's being seated properly in your mind, and everything that is just becomes second nature to you as you kind of talk through these things. All right. So that was strategy number one, just kind of getting you prepared. We want to make sure that you've got a healthcare presence out there in the market that makes you marketable, okay? So without that, right now, what you don't know could really truly hurt you if you try to go out there and pre-market anything else out there. All right. Any audience questions? Anybody out there have any other questions before I move on? Any other questions real quickly? Give somebody enough time to type if they're typing something. Okay. All right. If not, we're going to move on. Number two, we're going to start building what we call a healthcare building strategies. So think of it this way. Everything that we do is going to be built around this healthcare monstrosity out there. I mean, if you, and I'm saying healthcare, not just doctors anymore, because I want you to raise your horizon vision up a little bit, because out there in the healthcare world, there are so many people involved in healthcare that you would be shocked. And I bet you bump into people already that you don't even know that are in the healthcare industry. And if they knew that you were involved in this, they have a doctor that they can certainly help you with. So one of the things that we're going to teach you to do is cultivate your orbit of influence. Okay, so write that down. We're going to help you cultivate your orbit of influence. Number two, now we're going to cultivate those relationships with others who have existing doctor relationships. So remember this big old healthcare world that's in your community out there. We're going to get you introduced, or we want to show you how to introduce yourself to those home health industries out there, those people that are in hospice. Yes, I know hospice is can sound as an end, but there is a lot of good things that hospice groups do. But again, they know doctors. Okay, there are doctors who manage home hospice groups, and they need to do their billing for that particular group. So these are new areas that I'm trying to share with you. There are home care groups out there that they market directly to doctors. And then there's the tons of pharmaceutical reps that are out there already. Other people that sell other equipment to doctors. There are CPAs and financial advisors who work directly with doctors, who their specialty is healthcare financial advisement. So we're going to show you and point you to those folks. And then once you start to build that kind of a group of your customer relationship base. And again, let me remind everybody that now here at American Business Systems, you get a free CRM here, customer relationship management platform that's given to you as part of your business package here for you to utilize right off the very bat. We're going to show you how to use that, because that's where you're going to learn to cultivate these relationships and start getting together with these folks, having coffee with them, meeting them for lunch. You're building a trustworthy relationship with these folks here. And then lastly, how to cultivate those businesses into others' relationships within your community. So now you're going to go from big to here, and then finally you're going to be addressing a lot of these doctors here, because we know the number one way of getting your first doctor is truly through relationships. Why? Because other doctors talk to other doctors. There's not a lot of doctors out there that are looking on the internet trying to find a medical billing company. Okay, they're not researching. What they hear about is one doctor saying, hey, I just hired a medical billing company and they've helped me increase my revenue by 20%. That other doctor goes, I need to talk to them. Or some financial advisor that's focused in on healthcare, they know about you and they said, hey, doctor, listen, I know that you've been trusted me with helping you with your financial advisement. I just ran across Latanya. I'm going to use her as her name here. I just ran over a gal by the name of Latanya at my last Chamber of Commerce meeting. And she's already telling me that she's helping doctors already gain about 20% of their revenue back in their practice. Great. Can I talk to her? That's how this is how this works. Because again, it gets back to the old adage: people do business with people they know, like, and trust. And that's what it is. All right. Someone is asking, what is the CRM that ABS uses and how complex is it? It's Zoho, and it's very complex. It's very good. It has a lot of social media type stuff that's in it. I've never used it because I don't use that platform. But I know that now with our director over support, he's been using it for years. He uses it for his own business. And so if you'd like to get with your sales rep, they'll be able to kind of give you a little bit more detail to that. But it's Zoho CRM, and it's the full platform of that. Okay. Good question. I appreciate the question there. All right. Learning how to build your strategies. Now, here is where I'm peeling back the onion here a little bit. This is some data information I've never shared before on any other webinar. But I want you, here's healthcare specific organizations to join. These associations put you in the same room as your ideal clients. Okay. The first one is a group called MGMA. This is the Medical Group Management Association. Practice managers attend local chapter events. Okay? This is one of those organizations that you might want to just ask about or get online. I actually get their I have an email subscription to them that I get information from them daily. And there are people who are local within my area. I live in the Dallas-Fort Worth area. There are several chapters here within this area. I could go pop in on them at any time I wanted to and just get to know them. Now, what you don't want to do is walk into an MGMA group and say, "Hey, my name's Eric, and I'm a medical biller, and I want to know how you guys can help me." You're going to walk in and just say, "Hey, I'm part of the healthcare community here. I'd like to know some of the things that you guys are doing. What are y'all doing here locally? What are some of the things y'all are doing to help these physicians improve their practice in any way?" That's the questions to ask. All right, AAFP. This is the American Academy of Family Physicians. There are local chapters again in your area. They also do educational events all the time. Another one is AANP. This is the American Association of Nurse Practitioners. Nurse practitioners are providers, and many of them own their own business. They're supervised by a medical doctor, but they have to do their own billing. And these are low-hanging fruit types of people. So NPs are prime prospects for you. The NASW, this is the National Association of Social Workers. We have an entire, we call it a sales magnet, if you want to call it, that targets social workers, licensed clinical social workers, and behavioral health groups. So that's a process that we're already targeting already. But these are some of these organizations that you might want to look into. The American Physical Therapy Association, PTs. I took my wife to a physical therapist this week. He's a sole practitioner. He bills on a CMS 1500. He's going to bill for the services that we went to go see him the other day on. Someone's doing his billing. He doesn't have anybody in-house. He was a sole practitioner. He doesn't have a staff. Which means someone's doing his billing. See, I'm hoping through this webinar, kind of showing you that, oh gosh, how am I going to get a doctor that I can do the billing? I'm showing you other people in healthcare that you can help. And then there are either state medical societies or there's local medical societies. Like here, I live in Fort Worth. My county is Tarrant County. There is a Tarrant County Medical Society. I've been there. I was associated with them whenever I was doing medical billing. I got to speak several times at times whenever they had luncheons and stuff. I've spoken at some other medical societies since. These are great organizations. So again, if you're savvy enough and you can take a screenshot of this, be sure to take a screenshot of that right there. So those are some of the healthcare industries. Now I'm going to show you some of the business networking groups that you should join immediately or start looking into. BNI is one of them. That's the Business Networking International Group. With this group, there are several chapters within your area already. You can go, instead of having to join them, you can just go attend them as a visitor at least one or two times. I know that for sure. And who knows if you don't get a client right up from there. The Chamber of Commerce's, wherever you live, there's probably a Chamber of Commerce within your area. I know in my little community where I live, which is not even in Fort Worth, we're kind of northwest of Fort Worth. In my little community right now, every single month there's a luncheon there. Guess what it's for? It's for business people to get together. This is where there are chiropractors, there's physical therapists, there's dentists, there's people from the hospital there. There are case managers there. There are home health groups there. There are CPAs there. There are a boatload of folks there. And you just need to engage with these people and get involved with them. And then also there's other networking meetup groups within your area. But these three are the biggest ones. Now, one of the great things that we're going to teach you here, we're going to give you a real in-depth way of teaching you how to network, again, to jumpstart your business, utilizing something like a BNI to help you get that through there. Because it's through those BNI meetings there that we've had so many people end up getting their first client through a BNI meeting. Because again, These BNI meetings are professionals that come together, and they don't, in each chapter, there's only going to be one representative from a real estate agency. There's only going to be one representative from like a financial or banking institution. There may be only one CPA in that group. There may be only one financial advisor in that group. And guess what? There are not many medical billing groups that sign up for BNI. You would be one of the only ones. And then all of those professionals are, everybody's looking for the same thing. How can we help each other to get in front of clients that I already know? This is a beautiful way of helping you get in front of your first client. All right. Any other questions before I move on? Because folks, we are about 10 minutes to the top of the hour, and I've got to jump through some of these slides here for you. All right. The third thing here is going beyond the sales pitch. Okay. This is not a sales pitch type business. That's why I said if you come from a marketing background, I want you to throw out your sales pitch. We're going to be talking to you about how to personally look into the doctor's financial situations. That's what we're about. We're going to teach you how to do that. One of the great little nuggets that I've just recently come across on, and for those that are not afraid to go to doctor's offices sometimes and to maybe to drop a business card there. One of the things that I've learned that you can do is to create what's called a leave behind. Okay, and I'm going to show that to you here in a moment. But before I get to that, again, we're going to show you how to examine every practice's financial situation, include their billing, their performance, claim submission patterns, denial rates, collections and efficiencies. So rather than treating a practice identically, you identify their specific weaknesses and their opportunities and show that to them. That's the only thing. Remember, it kind of goes back to those 5 things that we talked about. If you're not touching on any of those 5 things there, and most of the time you can hit on all 5 of them, you're not going to normally get an audience here. But something brilliantly that I just came across here just really this week, and that is not only do so many people want to go by and drop a card off of a doctor's office or drop a brochure off, and typically everybody knows what happens to that. But there's a way in which you can create what we call the top billing errors. Now, folks, you can do that in a heartbeat. Create a little flyer or a business card, a 5x7 business card. Matter of fact, we've got a business card set already here that can be sent out through AutoCard. And then again, you can talk to your sales rep about this. But creating something brand new, something to leave behind. And just this week, I created this right off the top of my head. What are the top billing errors? And I listed them: undercoding or mischarges, claims errors and rejections, denied claims never appealed, credentialing gaps, and no follow-ups on aging claims. Those are the top 5 billing errors that happens in every single practice. On the back side of it, there are some solutions. And the solution is coming from a certified medical revenue manager working for your practice, solving all of those things there. I'm leaving this with an office manager. It's not a brochure. I'm telling you, if a doctor sees this in their office, top 5 billing errors, they start reading that, and then they look on the backside and they see some of the solutions, and they see part of the solution is you who dropped that off, because it's going to have your name on it, your phone number on it, your email on it, all of your contact information. So folks, this is not a brochure. It's something useful. You can laminate it. You can be creative with it, however you want to be able to. This is going beyond the sales pitch. Then whenever you do get in front of that office manager and you finally get that opportunity where it's coming from a financial advisor referral or somebody else, and you finally get to that doctor and you go through what's called a practice analysis questionnaire, this is what it's going to look like. It may be a little bit small for you to see there, but this is an actual one that I actually helped produce about 6-7 years ago. And as you can see there, what we did with the practice analysis, it's a questionnaire that just goes straight down the line. and you don't even have to memorize this. You'll just go through it pretty systematically with an office manager or a doctor, collect the data that you need to collect, and then we've got a revenue practice revenue report that will put it all out in a one sheet that's very easy to see. It's what their current practice looks like, what it could look like if it's projected, and then what's the potential impact on their practice. And in this one, hopefully you can see it through your phones or however you're looking at on the computer. But yes, that is a 17.8% revenue increase monthly. That's $26,000 more money that could be collected for that doctor. $321,000 over the entire year. This you don't have to sell. Once you've got this information into a doctor's hands, you've gone beyond the sales pitch because you're not pitching them anything. You're showing them where they're losing money and how they're losing money. And why would anybody not want to at least ask, how can you do that for me? All right, so last thing here. If you've got all of that, we're going to make sure that you're set up to make sure that you have all the professional content that you're going to need. We've got websites for you. I'm going to show one to you here just real quickly. We've already developed all the content around common billing challenges and solutions. So if you want to create that five top billing errors, you can do that and utilize ABS's provided material to help you reach decision makers. Obviously, one of the biggest struggles for most folks is making sure they have a professional looking website. We have a selected template of different websites that you can choose from to be your own personal website. You can color code it however you want to. You can change up some of the wording if you need to, but you're going to have all of that as part of your package here. Plus, you're going to have along the side, if you have something like a leave behind that says like the top 5 billing errors, you also have true printed material that is all looking alike. It doesn't look like something that's been printed off an inkjet printer or even a laser printer at home. These are laminated type of paper that's heavy, thick paper. It's 8.5 by 11. And it's got every solution that you have at your fingertips. For those, again, that were a little concerned about coding, here's this CodeWrite program. This kind of shows you we can help optimize reimbursements and bulletproof compliance. You can see that. If you want to get a copy of this, you can probably ask your sales rep for just a PDF copy of the way this looks so you can kind of just get a picture of it in your mind. Same thing about Audit Guard. Again, this is another way to help increase reimbursements, keep people out of with trouble of going through audits, and then Compliancy Guard. This is the whole HIPAA compliancy part of it that I mentioned to you earlier. Again, these are things that you have. This is why we don't call you just a medical billing company. You are a revenue cycle management company. Collections, everything that you need. And then finally, as I kind of wrap up here, one of the greatest assets that another leave behind, or another way we're going to show you how to get this content in the doctor's hands, is an actual written professional book called The New Thriving Medical Practice. It's about a 275 real page. It's not an ebook. It's a real book that's you'll have in hand that you can drop off or use as a leave behind for a doctor's office. The cool thing about it is that you get to have your name on the front cover of the author of the foreword. Your name is on the inside of the book. It's all printed, so it's print on demand. We've got that for you. And then plus we're going to show you how to take this and put little tabs in there so it helps the doctors get to where they want to get there a little bit quicker than just going through all that. Now, the last thing I want to show you is this. Here's where the proof is in the pudding, why a doctor would want to use you and outsource instead of doing billing in-house, to have it outsourced. And this comes down just to the flat out money part of it. So if a doctor has at least 1.5 type of billing folks that they have in their office, they're having to pay payroll taxes, workers' comps, errors and omissions, training costs, vacation time for people to take off, employee benefit packages, hardware and software, IT stuff. There we go. I mean, I had to turn off my phone there real quickly. The total cost of the practice typically runs anything from 75,000 to 80, $95,000 a year, just for having an in-house billing person. If they take those same amount of claims and have you do it, have it done outsourced, this is what it's going to look like for them. Taking those same 100 claims at 7% at $150 per claim, their yearly outgo is $54,600. There's a huge difference here. So just getting it outsourced to you is saves them money. Remember, it's all about cash flow. So I just wanted to kind of show that to you towards the end here as we kind of wrap up here. So today, this is what we've done. It's already 5 o'clock, and I need to kind of do my wrap up here. I know that some people have already had to drop off here at the top of the hour. But we've gone through a in-depth how to build your network and connect with leaders in healthcare.